Hello and welcome to this presentation on Outcome 2 of the Equality and Improvement Outcomes Framework. My name is Lucy Reed and I work for Health Education England as Deputy Head of Regional Library and Knowledge Services for London and Kent, Surrey and Sussex. This is one of a series of webinars on the Quality and Improvement Outcomes Framework, and you may want to watch the introductory webinar before looking into detail at each of the other individual outcomes. In this webinar, we'll be looking at the scope of Outcome 2, why it's important for you and your organisation, some questions that might guide your thinking about service improvement for this outcome, what you might be doing at each level of the service development, and some learning from the pilot in 2018. By the end of the webinar, you should feel more confident about evaluating your services against the levels of this outcome and have some ideas about the kinds of evidence that you'll be gathering. Outcome 2 focuses on evidence and knowledge mobilisation. I'll refer to this as mobilising evidence and knowledge through the webinar. I'll also talk about patient and public information, which I'll use as a shorthand for all health literacy activities and the work we do to support information for patients and the public. Outcome 2 covers the role that library knowledge specialists play in facilitating the mobilisation of evidence and internally generated knowledge to underpin decision-making, innovation and change in the NHS. This includes mobilising evidence and knowledge to inform clinical and management decision-making, using current awareness and alerting services to help staff stay up to date, mobilising internally generated knowledge to underpin decision-making, innovation and change, and enabling everyone to find, appraise and use good quality health information and promoting good health literacy. You'll notice that the outcome says that this will be facilitated by skilled library and knowledge specialists. This emphasises the importance of the library knowledge services staff acting as an effective interface between knowledge and evidence and the people who need it. Throughout the outcomes framework, we'll talk about library knowledge specialists, and we mean the whole library and knowledge services team, professionals and paraprofessionals, who all have a role to play in getting the right knowledge to the right person at the right time. Healthcare is a knowledge industry, and staff and patients need the right knowledge and evidence at the right time in order to make effective decisions. This outcome will help the organisation to assure itself that the workforce is able to access and use the right knowledge and evidence at the right time to support decision-making and best practice, that effective knowledge management enables staff to learn from experience and accelerate the adoption of proven innovations, and that the best available evidence is used to inform organisational and service redesign. For the library knowledge service itself, this outcome will help to ensure that the organisation is making best use of library knowledge specialists to embed effective approaches to evidence and knowledge across the organisation from ward to board. It will help you to show that you are having an input into a range of decisions, including management, clinical and patient decisions. And it will help you to show that you're involved in mobilising all forms of evidence and knowledge, including research evidence, good practice, patient information, organisational learning and staff know-how. Now we're going to look at the different levels of the outcome. As with all the outcomes in the framework, progression from level 0 to level 4 will take you through an increasingly mature model of service delivery. In all the outcomes, level 0 shows that the service is not developed or that the organisation is unable to evidence the indicators associated with level 1. For this outcome, outcome 2, an organisation operating at level 0 might have access to national core content, but no skilled library knowledge specialists who can mobilise that evidence or local knowledge across the workforce. Level 0 is for an organisation at the start of its journey towards an effective mobilisation of evidence and knowledge. At level 1, library knowledge specialists are providing a robust evidence search service which is supporting both clinical and management decision making. Requests might be made by individuals or small groups of co-workers, perhaps on an ad hoc basis by email or telephone. You might also be providing things like current awareness services to individuals or small groups. However, at level 1, you recognise the operational and organisational benefits of developing your service model to deliver some of the extended roles that are outlined in Knowledge for Healthcare. So, you can show evidence that you're planning to work with one or more team, perhaps in an outreach or an embedded way, to develop a bespoke mobilising evidence and knowledge service that delivers on their specific needs. And you can also show progress towards the implementation of at least one method of capturing and sharing organisational knowledge, perhaps using the knowledge mobilisation framework. The overarching aim of the Quality Improvement Outcomes Framework is service improvement, and so all services will be expected to have a service improvement plan following the baseline assessment. However, if an organisation is operating at level 0 or level 1 in one or more of the outcomes, staff should expect a more intensive monitoring of these service plans and to work closely with HEE's Library Knowledge Services leads who will provide support and guidance for service development. To achieve level 2, some of the plans that you were working on at level 1 have come to fruition. You're developing tailored services to one or more team. Maybe you're embedded within a clinical team, or perhaps the production of all trust patient information resources has to include an assessment of the evidence by members of your team. Are you supporting all quality improvement projects within the trust? You're also supporting the management of organisational knowledge and staff know-how. Do you run a regular randomised coffee trial to connect people across the organisation? Do you help colleagues with knowledge harvesting? Are you capturing local policies and publications in a repository? At level 3, you're moving from delivering mobilising evidence and knowledge activities in a subset of operational work streams to working with your senior stakeholders, making sure that service development and organisational decisions are underpinned by evidence and knowledge. Senior stakeholders will be working with you to identify and plan for mobilising evidence and knowledge developments which support organisational decision making. For example, perhaps the patient safety lead has seen your health literacy training and, as a result, has given you a slot on corporate induction so that all new staff get a taster. You'll also have evidence that some board and organisational decisions are informed by library and knowledge specialists. And you'll have adopted innovative mechanisms for capturing and sharing internally generated and tacit knowledge. By the time you get to level 4, the board and senior stakeholders recognise the role of library knowledge specialists in mobilising evidence and knowledge across the organisation. You're seen as business critical and your service is highly developed. There's evidence that all board decision making is supported by an evidence search. This might be written into a strategy or policy and then evidenced through examples of activity. Decision making across the breadth of the organisation is informed by evidence and knowledge, and you can show the impact of your contribution to the organisation. You and your team are developing innovative ways of mobilising evidence and organisational knowledge based on the needs that you've identified with senior stakeholders. Now for some questions which might help your thinking about this outcome. How embedded are library knowledge specialists across the organisations you serve? Are you delivering services which mobilise research evidence, internally generated knowledge and patient information? Can you map your reach across individuals, teams and the whole organisation? Are there parts of the organisation that you haven't reached, and what can you do to extend services to them? Can you show that a range of decisions, whether they're organisational, management, clinical or patient, are made based on library and knowledge specialist input? What are the gaps and what can you do to plug them? Does the board consider the expertise of library knowledge specialists to be business critical? Is the importance of knowledge and evidence recognised at board level? How are you supporting board members to use evidence and knowledge when they make decisions about services and the strategic direction of the organisation? Can you collect endorsements and show evidence of your impact on the work of senior stakeholders? Does the organisation have a knowledge management strategy? Did you contribute to it or lead on it? How do library knowledge staff identify what needs to be done to improve the way that organisation staff makes best use of internally generated knowledge? What engagement activities do you have in place to make sure that you're delivering innovative services to meet your organisation's needs? How do Library Knowledge Services staff know that their expertise has made a difference? As you probably know, in 2018 we piloted this new quality improvement model, and that's given us some learning which we'd like to pass on. Following the pilot, this outcome has been reworded to make it more clear that it encompasses mobilising evidence, knowledge and also patient information. It's also now easier to see what's expected at each level. In the pilot phase, the maturity model ranged from 0 to 5, so the scoring was different. But bearing in mind these differences, several pilot services scored level 3 from this outcome out of a potential 5. Relevant good practice identified during that phase included showing a range of ways in which library knowledge specialists are providing access to and encouraging the use of evidence through traditional services, synthesizing and summaries, websites, and so on. Evidence of close working with other units in the organisation, for example, the policy group, quality improvement, innovation, and the R&D group. Showing evidence for the impact of embedded services. Developing a network of champions and collecting endorsements from key stakeholders. Using knowledge management tools and techniques, including knowledge harvesting. Areas for development during the pilot included showing that mobilising evidence and knowledge services are planned and developed based on feedback and evaluations, making sure that evidence covers all aspects of mobilising evidence and knowledge, including research evidence, best practice, current awareness, knowledge management and PPI activities. Linking mobilising evidence and knowledge activities with impact, showing the end results of your services, not just feedback. By now, you'll be thinking of all the things that you're already doing that speak to Outcome 2, and the ways in which you can evidence good practice in mobilising evidence and knowledge as well as public and patient information. But what if you want to take this to the next level? Well, there's a lot of useful information on the Knowledge for Healthcare blog which will help you with mobilising evidence and knowledge and advocating for embedding your services across your organisation. Do also tune into the 2 workstream presentations linked here, which will give you an overview of the national priorities for things like knowledge mobilisation and public and patient information. Thanks for listening.